With new advancements in HIV detection, prevention, and treatment, we've reached an important new moment in the fight against the HIV/AIDS epidemic. We're at the forefront of HIV prevention and care efforts in Washington state. Our state has seen decreases in new HIV infections, new AIDS cases, and deaths in people with HIV or AIDS. The End AIDS Washington initiative was launched as a result of Governor Inslee's public commitment to reduce new HIV infections in Washington state by 50% by 2020. Getting insured, getting tested, getting PrEP, and getting treatment are great ways to help stop the spread of HIV. Together, we can end the HIV/AIDS epidemic in Washington.
I'm really excited about our End AIDS effort. I think this is really the right time for Washington. We have a governor who has said it is time to end AIDS and to work towards that. So he has challenged all of us in this state to make that a reality. We need to address all of these things. We need to address getting insurance. We need to address getting tested. We need to address getting PrEP if you're HIV negative and at high risk, and getting treatment. This is the time for us as leaders to step up and address all of this.
It's estimated that 89% of Washington's residents have health insurance coverage, providing free or low-cost access to needed HIV prevention, care, and treatment. Getting insured is an important way to help prevent the spread of HIV.
If you're insured, that means you're then participating in your health care, which means you're seeing a doctor, you're seeing professionals that then can advise you on how to then take care of yourself.
I feel like once I got insured, that a lot of avenues opened up for me, ones that had felt like barriers for a long time.
Just that basic fact of access to information really increases the likelihood of people participating in healthier behaviors.
You have access to just so much help.
If you have a healthcare provider that really works with you and that understands who you are as a person, you have higher health outcomes as well, because the person wants to engage with that provider.
According to the Washington State Department of Health, there are more than 14,000 people living with HIV in Washington. It's estimated that statewide, only 86% of people living with HIV know their status. Getting tested and knowing your status is the easiest way to help prevent the spread of HIV.
There are some guys that come in that are understandably nervous about getting tested, that you don't have to be afraid anymore because it's not the death sentence that it used to be.
Just from being tested, you get housing benefits as well. Also, you get tuned into social activities, and you become part of a community that you may not have been aware of.
Now, there are so many resources available to you, especially in Seattle.
If you think it's going to be positive, then you should go and have the test. Even if you think it's not going to be positive, you should go and have the test. Because either way, you're going to come out a winner, because you're going to get the care that you need, or you're going to find out that you don't need it at all. So,
when taken correctly, PrEP can reduce the risk of HIV transmission by as much as 92%. Washington State currently offers a PrEP drug assistance program that helps remove any financial barriers to accessing PrEP by helping to pay for PrEP for those who qualify. Getting PrEP is a powerful way to help prevent the spread of HIV.
So I had a condom mishap with a client. I continued on with just a Truvada once a day, and I've had no side effects at all.
Bringing more providers on board who are comfortable having these conversations is important, as well as potentially trying to increase awareness among patients who are interested in PrEP and increasing their awareness of where they can really access PrEP for providers who are able to have an honest and open conversation.
PrEP is definitely a way to make HIV as rare as any other disease that we've eradicated so far.
And PrEP helps to fill in those gaps for people to prevent HIV.
Recent studies have shown that being treated for HIV reduces the risk of viral transmission by as much as 97%. In Washington, 61% of people living with HIV are virally suppressed through treatment, making it nearly impossible for them to transmit the virus to others. If you're HIV positive, getting treatment not only helps prolong and improve the quality of your life, it helps prevent the spread of HIV to others.
We know that HIV is virtually 100% preventable and certainly 100% treatable.
Treatment is really important for my partners or for anybody that I'm with. It's important for their safety as well.
If a person is 100% adherent to their antiretroviral regimen, that the chances of transmitting the virus to someone else is reduced by over 97%.
Being diagnosed is hard for people. I mean, everybody in the world is going to tell you, oh, don't worry, we have treatment for it. But you yourself have to, realize that, and you have to go through a grieving process of, all right, I have HIV. My life isn't over. I need to do something about it.
Yes, we still want cures for HIV. I believe that our fight is around the stigma that exists within communities, the discrimination that exists within communities, that inhibit individuals from gaining access to treatment, that stand in the way of individuals, once they do have access to treatment, to continue to remain adherent to treatment.
I can't feel how grateful I am for living in a time with the medication that we have today, where it's basically for me a pill a day, and that's it.
We know how to stop the transmission of this virus through medication.
I am proud to live in a state that's proactive about ending HIV, ending AIDS.
Get insured, get tested, get PrEP, get treatment. Help end the HIV/AIDS epidemic in Washington state. To learn more about how you can get involved, visit endaidswashington.org.